for Hartford Healthcare. As part of the daily briefing, I'll just go over some of the details and happy to answer any questions. I have two of my colleagues today to talk about wonderful things happening in Hartford Healthcare, especially by one of our good colleague, nursing and respiratory therapists. These are the individuals who are in the front line of managing patients. So we're going to have a good conversation. I'll start with some of the patients we're looking after right now in Hartford Healthcare. We have 352 COVID positive patients across our acute facilities right now. Starting with Bacchus Hospital, we have 10 patients who are positive and 6 are PUI. These are the person under investigation waiting for testing to come through. Charlotte Hungerford has 15 patients who are positive and 5 PUI. Hartford Hospital has 160 patients and 62 PUI. Midstate Medical Center has 27 patients and 5 PUI. St. Vincent Medical Center has 95 patients and 16 PUI. Hospital Center Connecticut has 41 patients and 20 PUI. Wyndham Hospital has 4 positive and 2 PUI. 116 patients total are waiting for results. In our community network, we are also managing 138 patients in the outpatient setting, and Behavioral Health Network has 1 patient who's positive. As we talked about, we're starting the mobile testing centers at Mystic, Newington, Norwich area. That was an announcement we made yesterday, and this is our commitment to our community to extend and create more testing capabilities across the state. I do want to talk a little bit about testing. It's critical for us to know what the spread of the virus is in the community, and the more access to the testing we have, it allows us to better predict and better prepare as well. So my plea to the community is that if you have symptoms, if you do need testing, don't hesitate. Call our center. We want to get you tested at this time. We want to make sure you have access to the testing in your community so that we can understand how to really care for you. We are obviously launching our mobile testing center, especially in the most vulnerable communities in our state. We want to make sure the individuals who don't have the cars or capable means of transport, for whatever the reason they're unable to come because somebody can't bring them to the testing center, we can go to them. We can go to the proximity in their neighborhood to be able to test. And that's important because the most vulnerable population, the underserved, the individuals actually who have the chronic medical disease, are generally the ones who have difficulty in transport in other areas as well. We want to make sure that everybody knows that everybody can get tested, actually, who wants to get tested. Initially, when we were short of viral test media, we had talked about the swabs, and several weeks ago, we were struggling with that, and we were making sure that we had some prioritization who gets tested. But right now, with a lot of good work by the leadership in the Hartford Healthcare and the Quest, we've been able to open a tremendous amount of testing capability within the system. So I encourage everybody to please seek out the places where you can get tested. We're also reaching out to the businesses, actually, who are looking to reopen, looking to think about what the strategy would be when the governor allows us to come back to our work places to work. How can we support them? How can we support their individuals, their customers, and their the members of the team in testing as well? So we want to make sure we support our recovery effort across the state of Connecticut as well. I had mentioned yesterday emergency rooms and how we prepared to make sure that we safely accommodate any patient who comes in our emergency room. We have seen, obviously, less number of patients are seeking care at this time during the COVID crisis. And I'm hoping that the people actually who have some chronic disease or any other illnesses, not putting things off, worried about the safety in the hospitals. Our emergency rooms are prepared in such a way that we actually do screen everybody who's possibly COVID. We transition them differently if there is a suspicion, and the individuals who are coming for non-COVID related issues are transitioned. We're exploring the possibility of testing everybody who comes to the ED at this time to make sure that everybody who's in the hospital remains safe, and the community as well gets some information about the testing. So our capabilities of testing will be utilized in those areas as well. We continue our processing N95 reprocessing and decontamination effort. I had mentioned this is well received by teams. And obviously, we continue to work on a plasma, convalescent plasma therapeutic as well. These are generally a few of the updates I have. We've talked about the peak for several days. As you've seen, the state of Connecticut has seen a decreased hospitalization for almost 6 days right now. Hartford Healthcare is also seeing a decreased as well. We had the highest number we had about 22nd of April, and then after that 24th of April we declined. And from 24th till 29th, remaining a very small decline, but definitely a decline in the number of cases across the system. So that's where we are right now, and we're going to hopefully continue to see a hospitalization decline unless our SNF or assisted living communities sees a significant outbreak, which remains a concern for us. Active cases in Connecticut will continue to rise because you're testing more people. But I would not be concerned about that. With the effort governor is putting on the contact tracing, increased testing, I think it's going to help our community to get back on the feet together very quickly, hopefully soon. With that, I'm going to introduce one of my colleagues, Marisa Serenson. She's a nurse who's been working in Hartford Hospital for a while, and she's a cardiac catheterization lab nurse, and she does amazing work of making sure the individuals who are going for cardiac cath, a very complicated procedure, she's in the front line in managing those patients, so she's going to tell her story. Marisa.
Thank you, Dr. Kumar. Good morning. My name is Marisa Serenson, and I have been a nurse for several years. I just came to the Hartford Healthcare in about a year ago, and it's a wonderful, great place to work. I work with cardiac cath lab patients as well as arrhythmia patients. We were recently, during this whole COVID experience, our nurse manager had come to us, and we're talking about the crisis in the ICUs, and we were asked and willingly going to the ICUs for help since there has been this peak in the COVID patients. I am a support nurse over there in the ICUs. I help the nurse daily with the baths and the checks on the ventilators and just the overall care of the ICU patients. We did have to have some additional training prior to going to the ICU since we are in a specialty unit. We had to have some ventilator check experience again and some epic charting to get us ready to help with the nurse in any way possible. I do have to say that helping out in the community, helping out on the nurse as a frontline nurse has been a great experience for me, and the community support from my family, my friends, the Hartford Hospital community with the lunches and the signs and the thank yous have been wonderful and very much appreciated. So thank you for all your help with this crisis going on. Dr. Kumar?
Thank you, Marisa. So Marisa is one of those nurses who really raised her hand to help each other out and was part of our redeployment workforce as an integrated healthcare system. We may want to make sure that we utilize individuals from areas with tremendous expertise, which are less busy, and place them in area where there is a critical need. So the volunteerism and the forthcoming attitude of our nursing has been quite heartwarming for all of us. With that, I'm going to introduce another colleague of mine, Mr. Sajjad Raza, who's a respiratory therapist. He's going to explain what exactly that means to be a respiratory therapist, but he's one of the individuals who's really in the front line managing all the COVID-19 patients. Sajjad.
Hello, my name is Sajjad Raza. I am the lead critical care therapist, respiratory therapist in our Bliss 11I Medical ICU. Dr. Kumar is right. We have been on the front lines since our first patient, and my involvement with the medical ICU patients involves rounding with the physician team to discuss oxygen therapy, ventilator management, what modes best to help improve patient status and work towards getting them extubated. working with the nursing teams on proning patients, working with speech pathology to make sure patients' swallow reflexes are still intact. It's a very involved effort. And this past month has been challenging, but I would have to give credit to the entire ICU staff, the respiratory department, almost every department in the hospital pretty much, for stepping up and being able to come together and work as a team for as long as they have. It has been very intense these past few weeks, but we have been able to rise to the occasion, and it's been quite the experience. I'm very fortunate to work alongside such wonderful and amazing, talented people. That's about it for me. I'd like to reintroduce Dr. Kumar. Thank you.
Thank you, Sajjad. I'll open for any questions. There are two other questions already came in the Facebook. Maybe I can start off with that. One is regarding, would we have our testing capabilities in Charter Oak? And yes, we would. We would be supporting that area as well. And the second question regarding the antibody testing.
Yeah, it looks like, can you comment on what Quas new antibody testing that is now available at their centers? Do you recommend people get this test?
Yeah. So antibody testing is a test which actually allows us to know whether somebody has been exposed or had infection with coronavirus. Generally, there are two different types of antibodies. IgG antibodies, what we're testing at this time, which becomes, when the patient actually gets an infection, our body reacts in a certain way and produces a protein called antibody. Antibody takes about 10 days to be available in the body to be tested. So after 10 days or so, if you were to test, you would know somebody had been infected. Now, the challenge we have right now, we don't know whether this antibody provides immunity or not. Of those individuals who are looking to find out, am I immune to the future infection of the COVID-19? We do not know at the moment whether this antibody does provide that protection or not. We like to think it does, but we don't have any conclusive evidence in the research right now. Over the next several weeks, I think we will have a lot more clarity on that part here, but right now we don't know. So this testing can be done. Anybody can access and get the testing done through the Quest, and to know whether I had a previous exposure or infection. But I wouldn't want anybody to assume that would provides a certificate for immunity right now, because we don't know that at the moment. The second part is that if you didn't have antibody in your body, if you test yourself and you didn't have antibody, it could be the timing when you actually got the testing done. It may not be matured. So it's sometimes a very small percentage of the people, it may not be inconclusive enough whether you had an infection or not. So if you are getting the testing done, it's definitely, I wouldn't say don't get it done, but just know the caveats. Make sure you ask the right questions before you get the testing done.
Another question from Facebook. If someone is asymptomatic, how long are they typically contagious? 2 weeks or more?
Someone who's asymptomatic but tested positive, I just want to make sure we're clear on that part. If somebody's asymptomatic but tested positive, generally we like to believe that the virus can actually live in the body for the next 42 days or so. So there's a long time, unfortunately. However, we believe with the universal masking, with all the precautions we take, the infection period, the shedding of the virus goes down rapidly. So generally we advise 7 days post that last time you had any symptom, or 72 hours from the last time you actually have been coughing or any of the symptoms you actually have actively had. So there are CDC guidelines which allows for the symptomatic one. Asymptomatic remains rather challenging at this time.
One question, will they ever start testing everyone?
Would we ever start testing everybody? So just to give you some perspective, Portugal, which is a smaller country, does about over 30,000 or so testing per million patients population. Canada does about 20-something thousand per 1 million. US does 17,000. So we have a lot more catching up to do. We have 1 million cases in the United States, and if you were to do a lot more testing, we would probably have a lot more results to come through which are positive. Would we test everybody? It depends on really epidemiological question you're trying to answer. I don't believe there's a necessity to test all 350 million Americans, or 325, whatever the number is right now. But I do believe that the segment of the population needs to be tested. Our testing needs to be a lot higher than what it is right now. And generally, we believe that at least in Connecticut, every week we should be testing 50,000 or more individuals at this time. So there is a mathematical model which can allow us to give us some sort of approximate idea, which understands the prevalence of this virus in the community, but we don't need to test everybody. Questions?
Yes, this is Ryan Lindsay with Connecticut Public Radio. You mentioned the mobile testing centers are being established in Mystic, Newington, and Norwich. Is that correct?
No, in Norwich, Newington, and Westport, we would have a testing station, not mobile, but the real, as a testing station we have in Hartford and other areas. On top of that, I'm sorry?
I'm just trying to get clarity on, I've heard about the potential of a mobile testing center in the north end of Hartford. I'm wondering if that's happening or any other mobile testing centers that you all are establishing.
So just to kind of take a step back, with two things that are happening. We're opening 3 new testing centers, which are physical location where people can drive up and get testing done. That's in Westport, Newington, and Norwich. Mobile testing stations would be a separate entity, which we're going to be starting, which is going to be in the North End, Charter Oak, and other areas. So there are 2 different things that are happening. And mobile centers testing station are already started today.
And the mobile one in the north end has already started?
I like to believe yes. Tina can confirm in a few minutes. I'm almost certain yes, but I will confirm on the north end. But that was a plan yesterday, as of yesterday.
And then just also in terms of testing, so there's 2 different types of testing. There's the regular testing that one could get if they thought they had coronavirus, and then there's a separate test that would show whether or not a person has antibodies within them?
That's right. There are 2 different types of testing. One is a PCR testing. That is a testing whether you have active infection of coronavirus, and antibody testing if you had an infection with coronavirus. So what we are offering through the mobile and the testing side is if you have a testing, that is a PCR testing.
And that's for the active one?
Active one.
And also, you mentioned that, so before you were talking about it was limited and very discretionary on who could get tested, but now does a person have to have that referral from their primary care physician or doctor in order to be able to get tested at one of these sites, or can they just come?
Well, I think having a referral is always it's actually required because we want to make sure the positive result is tested and followed by the physician. And if it's negative, there is a physician able to provide some counseling. What does it mean? So prescription is required, but if the people don't have any doctor, they can call a call center and we'll manage that.
Okay, so the referral is still required?
That's right.
Okay. Thank you.
Thank you.
So, Dr. Kumar, if a referral is still required, what exactly has changed? You said now more people are able to be tested, or you're able to test a wider range of people. So what exactly has changed if that?
2 things. One, thank you for asking. 2 things. One, prior to this increased capability, we were testing only 120 to 140 patients, community members in a day. Now we can test up to 2,000, 2,500. So there's a large number of volume we can test per day. The second thing which has changed is that previously we were testing individuals based on some criteria, age, comorbidities, chronic medical conditions, along with symptoms. Right now we're testing anybody with symptom. It doesn't matter whether you have certain age or comorbidity. So we've relaxed our criteria almost to symptoms at this time.
Got it. Thank you.
You're welcome.
This is Aisha from Fox 61. I have 2 questions.
Mm-hmm.
The first one for Dr. Kumar, and then the second one for the 2 healthcare workers.
Yeah.
My first question, Dr. Kumar, if you could just talk about contact tracing and where it fits in the puzzle of being able to reopen. We've heard a lot of talk about contact tracing.
So contact tracing is a methodology when if I'm infected, you trace back who I might have been in contact in a defined period of time, and track those individuals as well, and advise them to either get tested or quarantine, and that's the one way of limiting the spread of the disease in the community. So that is exactly what the contact tracing means. If you put the testing, social distancing, and contact tracing, the three different measures, and good infection prevention techniques such as washing hands and things like that, that is one way of responding to the pandemic to prevent the spread. So if in state of Connecticut we were to do contact tracing of anybody who possibly is infected or has been in contact with an infected person, and we proactively isolate those individuals and ask them to be quarantined, what would allow us to do is the spread of that virus will be limited. And the limit of the spread of the virus is really important for pandemic to somehow decline and dies away. And that's generally how the science behind the pandemic works. So it's one very important piece of the puzzle which we need to have in our society to be able to contain and manage. And once you have reduced the infectivity rate of the virus to a certain level, then the management of that disease becomes rather easier through our healthcare systems, through our capabilities, and generally the virus finds its way out or reduces significantly over the time because there's nothing much to spread because the individuals who've been infected are contained and they're not infecting anybody.
Thank you.
You're welcome.
And then my second question, if either you feel comfortable answering it, we've heard, I think the respiratory therapist talked a little bit about the challenges of being on the front lines. I guess if either of you can just paint the picture for the everyday person, what it's like being in the front lines and in the middle of this pandemic and being the people that are helping these COVID patients.
I will have Mr. Raza answer that question.
Hello, could you just repeat that just one more time, please? Just
Just trying to, if you can just paint us a picture, if you can, I guess in a few words, what it's like being in the midst of the pandemic and being in the front lines of helping these patients that are COVID positive and doing that as a job and what it's been like.
So the job itself hasn't necessarily changed. I think what is challenging now is how to address an ever-evolving and a changing situation. I mean, from respiratory to nursing to all the other departments that are assisting, everybody has sort of expanded their role in treating these patients, but the level of care has been the same, if not heightened. It's the same thing. I mean, we don't necessarily do this for any other purpose than to serve our communities and to serve our patients, their families, their loved ones. So the challenging part is how do you do that in an environment that's now, I'm sure everybody knows that, it's family members can't visit, loved ones can't visit, so kind of doing what we can for our patients by using iPads to FaceTime their loved ones and family members and trying to do what we can, playing their favorite music. We'll ask family members, like, what music do they like? We'll play that for them to get them feeling a little bit better. But the situation has been challenging, but it's also stayed the same in many ways. I mean, we're doing our best, and we're still doing our best, and we are, I wouldn't say overwhelmed, but it's we're just meeting new challenges head on. It's a new reality, I would say. Yeah. Thank you.
Thank you.
I just wanted to clarify also, on the mobile testing center, can you describe a little more in detail about what that looks like? Is it a van that's going to particular neighborhoods, or what does that actually mean in terms of mobile testing?
It's a van with the testing capabilities, acquisition of the test, and it would be going out to the neighborhoods. We're working with the local leaders of the neighborhood, so we're working with the local leaders to make sure the right folks actually can get tested. So it's a van actually which is driving around with the capability of to be able to take the samples.
And then those three non-mobile testing centers that you mentioned, those have already been established, or they're in the works?
They are already established. Yesterday they were waiting for a state's approval. I need to confirm whether the state has given approval or not.
Okay, is that something that Tina could communicate once you all have that information?
Yes, Tina would do so. Yeah.
Thank you.
Thank you. I do want to go back to Mr. Raza's comment. The respiratory therapist plays a huge role in managing the COVID-19 patients. Generally, as you know, these patients are struggling for air and they're short of breath. What respiratory therapist allows us to do is that they're the capabilities that to provide medications to help ease the breathing effort, provide oxygen, adjust the oxygen requirement. If the individual needs to go to the ventilator as per the direction of the physician, individuals like Mr. Raza manages that placing on the ventilator, monitoring how the progress is happening, making sure the patient's comfortable when the ventilation is being provided to the ventilator. So it's a critical job, and it's a risky job because you're exposed to individuals who are COVID positive and very near to secretions. Respiratory therapist plays a huge role in managing those patients. Any further questions?
I have a question.
I have a question.
Go ahead.
So I know that obviously this is a stressful time for the average person, and we just heard from the respiratory therapist about how it is a challenging time. So I was wondering more for healthcare workers if there are any measures being taken to kind of keep the hospital staff mentally healthy, in good spirits. What's being done?
Yes, actually, we're really proud of that, actually, the work we've done in Hartford Healthcare. We established what we call as a colleague support center several days ago, actually. It's been in place from, I think it's from 14th of April or a little earlier than that. Well, the colleague support center is a one line, one phone number from any of the members across the Hartford Healthcare to call for any support they need. And it could be a psychological support. It could be I'm exhausted, I just need to talk to somebody. I'm overwhelmed and I need to get some help. I'd like to ask some help from anybody, my peer or anybody else. Childcare support. I need some place to stay tonight because I can't go back home. I have concerns about I'm just overwhelmed with the challenges I have. So we can manage all those things. Now, the colleague support center number is provided to all our members. And they can access the information. Also, we have specially designated areas for respite period, especially in the critical care areas for individuals like Mr. Raza and the critical care nurses who are working. And they can go back and get some break and get access to the pantry, some small food items. And there is a phone line dedicated in every single critical care area across the Hartford Healthcare to reach out to that colleague support center at any time, 24/7. And we're able to do that because we have a large behavioral health network and our capabilities within the system to be able to provide that level of support to our colleagues is extremely important. As we think about the journey on the COVID front from response to recovery, one of the concerns we have is the trauma or the emotional exhaustion our teams are going to be facing, not just the Hartford Healthcare, but across the country, all the healthcare workers. We need to be able to find a way to support that. The resiliency and building that strength is going to be critical for us to sustain, to be able to provide service to the community.
Hi, it's Bridget from the Republican. A question for Marisa or Anthony.
Yep.
Can you describe for us the strangeness of this disease close up? It has a habit of sometimes improving and then decompensating, and the symptoms are changing. And now we have stroke concerns, and younger and older, and it must be a challenge to the way you have trained to treat symptoms.
I think I'm going to make some comments. I'm going to have Marisa or Mr. Raza comment on that later on. So novel coronavirus, as you know, it's still new. We're still learning about it. It's April. We began to learn about this virus in the end of December. 4 months is the time of experience we've had with that. And you've seen that the CDC has changed several times the guidelines, the symptomology, new complications, who gets affected. There's a lot of unanswered questions right now we have about COVID-19. The disease in itself, as it presents with some symptoms, which are sore throat, shortness of breath, cough, fever, malaise, loss of taste, diarrhea, and a few other things. Varied symptoms, sometimes unrelated in many ways. So it's been challenging. And that's one of the reasons this pandemic has spread the way it has spread, because the complexity in the spread on that part here. After a few days of exposure to this virus, generally, after the incubation period, which could be 2 to 3 days or so, 5th to 8th day is a complex period. That is a time when the patients actually really show different symptoms, or they either get worse or they get better. And this is generally the body's response, what we call as a cytokine storm, which actually responds to the virus at that time. And generally at that time, some patients end up requiring ventilation or additional help to breathe because the lungs get filled up with water or solution, so which actually makes them difficult to breathe. That's why we need the ventilation support at that time. Otherwise, the patients can get exhausted to breathe. And some patients actually do recover at that time. It's a little bit of a puzzling details for us at the moment, which patient is going to go which way. So that's one of the reasons we advise patients actually who are feeling the symptoms, who are getting short of breath, unable to cope, unable to manage at home, unable to eat, unable to take care of themselves, seek help so we can support them in the hospital. And what we are able to do in the hospital, any part of the country, is provide the supportive therapy, the oxygen, the different maneuvers to increase the oxygenation in the lungs, as we do with our experts like Mr. Raza and other members do that. And that actually allows them to go through that crisis period, hopefully, and then after that recover in the other end. But the challenge has been that we've seen that this disease also includes increased blood clotting disorders. So we've created a protocol to make sure the patients don't have blood clotting. There is a risk about, we still don't understand what the long-lasting effect of this disease is going to be on the lungs of these individuals who have recovered as well. That is something we still don't know on that part here. So there remains to be unanswered questions about this disease, and that's why it's been so challenging. And that's why we see this once-in-a-lifetime pandemic, which is spreading across the world.
Thank you.
You're welcome. Any other questions?
Yes, Dr. Kumar, it's Lisa at News 8. Can you talk about, maybe give us an example of how convalescent plasma or a drug has worked to help a patient, how you've seen this actually work and gain hope from it?
Yeah. So just to go back, convalescent plasma is concentrated antibodies extracted from the individuals who have recovered from the coronavirus. Well, the theory is that if you give this antibody to somebody who's really critically ill, and we've exhausted other means of treatment, we give those boost of antibody, and hopefully the body is able to fight off the coronavirus at that time. That's the theory. Now, as we know that this is so new and it's been used only in some selected patients across the country, we're still learning about this. And this is why it's a research protocol under Mayo's and Johns Hopkins direction to see whether the therapy and the individuals who don't get a therapy has a different outcome. Our very small sample size in Hartford Healthcare of several patients we've treated, we've generally been favoring the treatment. Our clinicians are advising me right now that we need to continue the therapy at this time. But I do want to make sure there's caution on that. Still, it remains a research project. It remains to be studied properly. So I wouldn't want to make any early judgment based on the short amount of trial period we've had on that part.
And Dr. Kumar, I have a question from one of our correspondents about the Hartford Healthcare Home Program.
Mm-hmm.
We have reports of nurses going into the homes and then seeing patients, and the following day hearing the person tested positive for COVID-19. Are you testing nurses that are in these roles? Yeah,
so we, as you know, Hartford Healthcare has one of the largest home healthcare program in the state of Connecticut. So we have a tremendous amount of people actually who are really able to go to the homes of the people and provide care and services at this time. We have a very strict protocol. Every single member who's actually involved in that home healthcare process is trained, is provided PPE, provided education, infection prevention methodology, hand hygiene, and many other things. All of it were trained all in Feb because we knew that this is going to be a challenge for us. And that prepared us very well to manage those situations. How you enter the room, what questions you need to ask. You call before you enter to make sure you understand if somebody's symptomatic, you take extra precautions. Individuals who are exposed, and what we define as an exposure based on the high risk, low risk. High risk that more than 20 minutes exposure in unprotected environment. Those individuals were initially put on the quarantine and tested. Now at this time, because the prevalence is so much, and we've got a universal mask and everybody's got all the appropriate PPE, our incidence of high-risk exposure is almost none at the moment. And that has really allowed us to manage our workforce. But if the individuals show any symptoms, we do test them.
And it's Lisa again. May I ask about nursing homes? You had called them the wild card for an outbreak. We talked about the death toll between 2 and over 6,000, and they could make or break that. Are you happy with what you're seeing going on in nursing homes with the state, what they're doing, what's being enforced? Talk about nursing homes. I know that's been a big concern of yours, please.
I'll make this the last question because I got an indication from Tina. Look, the devastation we have seen with this disease, the mortality we have seen across the country in the state of Connecticut and any segment does not really make anybody happy or content where we are right now. I wish we had different outcome where we are right now. Obviously, the number of deaths happen in nursing homes or in the hospital situation is concerning. I like to believe that the state actually has done as well as they could have done given the constraints we had, given the challenges we had. And the challenge is what I like to believe somewhat external. The PPE supply, the supply of the testing, and somewhat internal, maybe the education, how well we were prepared from the nursing home standpoint as well. As I mentioned before, the Hartford Healthcare started working with all the state nursing homes, providing education and support and all that. Right now, we have a defined plan for any nursing home in the state of Connecticut to reach out to us and advising about the infection prevention strategies, advising about the right way of putting the PPEs and taking them off. So we've done a lot of work with that. But are we satisfied? No, I wouldn't say we are satisfied with the number of mortality we have seen at this time. And hopefully, we can contain that and we can manage it better as we go forward. And we'll learn something from this and better be prepared and prepared better for next time and if it happens. Well, I'd like to thank everybody for all the questions. I think we've covered a lot of different topics and hopefully we'll be back tomorrow for more questions and discussions. Thank you.